I'm going to verify my orders and then I'm going to knock. Good afternoon. My name is Brooke. I'm going to be your student nurse today. I'm just going to perform hand hygiene and provide the patient privacy. Can I have your name and date of birth, please? And can I see your wristband? Okay, thank you. The doctor has put in an order for a urinary catheter. Have you ever had one before? Okay, it's just a small tube that I'll insert on you, and it will go into your bladder and drain your urine. Since you've been retaining a lot of urine. Do you have any allergies to betadine, tape, or latex, or crawfish? Okay, and is it okay if I touch you? Now I'm just gonna pull covers down, and I'm gonna position you. All right, and I'm gonna get my kit ready. All right. I'm not going to use these. All right, this table is not big enough, so I'm going to slide this up just a little bit. Okay. Oh, I'm going to put this down first. All right, I'm going to put this shiny side down first. Okay. And then if this was a male, I would use this, but since she is female, I'm not. All right, and now I'm gonna put my gloves on. All right. I'm just gonna slide that off. Okay. And now I'm gonna turn my box around. All right. Drop that in the trash. Okay. And now I'm gonna open my iodine swabs. I'm gonna place them in the box. Okay, we don't need that. And I'm gonna open my lube and place my catheter in it. All right, And now I'm going to do some prenatal care. You're just going to feel me touch you real quick. I'm just going to prep you and clean you before I insert the catheter. And I would spread and hold the labials open. And you want to clean closest to you, so I would clean, come around, drop it. And then clean down the middle, come around, drop it. And then clean outside, come around, and I'll drop it. Alright. Alright, we're going to I'm about to go ahead and start placing the catheter in you. I just need you to bear down for me. You might feel a little bit of pressure. Okay, so I would insert the catheter until I get a flash of urine, and then once I do get a flash of urine, I'm going to go 1 to 2 more inches in. And then I'm going to pinch it after I've done tugged it. And
oh my goodness.
And I'm going to put 5 cc's in it. I would do 10, but for the purpose of the video, I'm not. Okay. And then I would unhook the syringe.
What happened?
And I would put a new pair of gloves on, and then I would secure my catheter to the stop lock on the patient's leg. So I would hook this to the hooks on the bed rail, and then to take the catheter out, it's not a sterile procedure, but I would put gloves on, and I would check the bag, and I would empty it, noting the color, consistency, and odor, and how many milliliters in the outtake of the urine. And then I would let my patient know that I'm gonna be taking the catheter out, and I would just hook the syringe back up with a new pair of gloves on, which this is not sterile, this part isn't, and I'm gonna deflate the balloon. Alright. And then I'm gonna let the patient know that I'm pulling the catheter out. And if this was a patient male, the catheter would be inserted more than 1 to 2 inches, because the urethra is longer. If this was a circumcised male, I would pull the foreskin down and clean the meatus 3 times, and then insert the catheter, and then lift the foreskin back up. And circumcised male, same way, except for I'm not having to pull the foreskin down. And that's really the main difference between the female and male. And then I would dispose of all of this. And I would cover my patient back up and make sure they're comfortable, and I would correctly document it.